I've been a practicing physician for 43 years. I initially was an emergency physician, and then I branched into full-service family practice. While I was in family practice, I became head of general practice at Lionsgate Hospital and then chief of staff. As we moved into a health authority model, I became a senior medical director responsible for 6 facilities. Well, I got interested in Medipure primarily because of our CEO, Boris Weiss. When he approached me several years ago, I was very impressed with his timing, his vision, and his dedication to this initiative. And this initiative, when completed to fruition, is going to provide research and production of a whole new line of medication, which I think has got an opportunity to help a huge population. And the more I've learned about it and the more I've studied it, the more significant I think this system is in the human body. A system that's responsible for neurotransmission, for cell synthesis, for cell metabolism, and a system that very little was known about until recently. As a physician, I depend on science to help me understand what's going on in the human body, but more importantly, to help me understand disease process and the ability to treat or alter those disease processes. When someone comes to me as a patient, I've got an obligation to treat them in the best, safest way that I can. And the only way I can assure that is to base the decisions I make on scientific research. I think what excites me the most is the team that is now put together with Medipure. The knowledge, excitement, and thoroughness of our scientists and researchers is phenomenal. The energy of our executive team and the leadership of our CEO is really enlightening. The big advantage to Medipure for doctors and patients is the ability of doctors to confidently prescribe new medications that have a scientific basis, have research behind those products that show that they are effective and safe, and provide an avenue of treatment that's not been offered before. For example, if you look at pain medication, we know that the endocannabinoid system is a neurotransmitter, and modulating the pain neurotransmission system may really help in the treatment of pain. And that's a very important area right now, particularly with some of the concerns of the current treatment options. I think of the opioids and the opioid crisis. If we can have an adjunct to those treatments or an alternative to those treatments that's safer and equally or more effective, what a wonderful advance.